lactation consultant here. We do have 7-day coverage here at the hospital, which we're very proud of. I'm going to be teaching the first half of the class, and Jimmy's going to teach the second half of the class. I like to keep it casual, so if anybody has any questions, feel free to shout them out anytime. I don't want you to have to remember them and ask them later, but feel free to also ask at the end of class if that's more important too. We're pretty clear on what Lori covered last week, but some of it might be some things that she talked about last week. The most important thing about breastfeeding, one of the more important things, I should say, is the positioning and the latch. Those are both really important, so you might hear us talk about that over and over. But I've got some slides here that we're going to run through, and we don't have copies of this for you, but it just will help maybe see a visual of it. And this mainly is talking about the first few days of breastfeeding, what's important in those first few days. So the first 2 weeks are really important with breastfeeding. You really want to get it well established. That's when your milk supply is forming, and that's when your baby's brand new and getting used to the outside world, and they need lots of attention, lots of skin-to-skin contact with their mom and dad. So one thing that we have found is very helpful is to breastfeed right after delivery. There's lots of research to prove this, in addition to just common sense, that as soon as your baby gets here, they like to have skin-to-skin contact with their mom, and we like to try to avoid bathing the baby before their first feeding. There are actual hormones involved that the baby has on their hands, that when they touch their mom, then it starts to smell familiar. There is oil that's secreted on the mom's areola that smells like amniotic fluid, and that's sort of a target for the baby. So there's reasons why we really like for that to happen, and feel free to request that if it's appropriate to try to nurse within the first few minutes after you deliver. We like the moms and babies to stay together for the entire stay here at the hospital, including through the night. We do have mother-baby together at night here. We find that that's the best scenario, and unless it's medically indicated, we love for the moms and babies to stay together for the entire stay. Yeah?
Are both of these standard procedures here at the hospital?
They're definitely standard procedures that we like to follow, but feel free to help us follow them. And sometimes it's not medically indicated for baby to stay with mom, or maybe mom needs more attention for some reason, but that's what we would like to happen. So one of the main things you're going to be doing in the first days is waking up your baby. It's a full-time job to wake your baby during the day. Now at night it's no problem. Your baby's happy to play with you all night long and talk to you in their best language, which is crying. But we really like for you to try to wake the baby a lot during the day. And you'll hear us say that over and over. Wake your baby. Have you fed your baby? We encourage you to feed your baby every couple of hours in the daytime. They are hard to wake up, and we're here to help you with some strategies to wake your baby. One thing that we find very helpful is just moving the baby around some. Once they get moving around some, they have an instinct to open their eyes and see who in the world is moving them around. We usually will also remove their hat, their blankets, and sometimes we do unsnap them and strip them down to a dry diaper if they're being really sleepy. Putting the baby skin to skin on mom's chest is a great way to wake up a baby. We encourage you to do that. And then it talks about moving the baby from side to side. Usually we put the baby right here. Has anybody brought a baby doll tonight? I see one there. Let's do your baby. And then you put them right here and you start moving them around like this gently, not so they're going to throw up on you, but just moving them around like this and maybe giving them a little dip like this. And this is a good dad job while mom's getting ready to nurse. This is a good way to wake up your baby. You spend a couple of weeks trying to wake up your baby in the daytime, and the more you do that, then the quicker you can start to have more sleep at night. And then you spend the next 18 years trying to get them to sleep. Massage is also a great thing to do. Babies love massage just like we do. Helps them also stool better and gain weight better. So we encourage you not to wait for your baby to start crying as a feeding cue. You'll quickly find in the first couple of weeks, if you go ahead and wake up your baby in the daytime, they're much easier to latch on. And if your baby's fussing really hard and you're trying to latch them on, sometimes that can really set up sort of a battle scenario. So you may want to, if your baby's crying really hard, just try to calm them down before latching them on. Any questions about waking up your baby? So what are some feeding cues? Everyone sees the baby's hand go to the mouth, and we're thinking, oh, they're starving. Has anybody seen on a sonogram your baby with their hand in their mouth? Has anybody seen that? So your baby starts practicing sucking on their hands, usually maybe even as early as 30 weeks inside you, they're starting to suck on their hand. It's an instinct to suck. It's a survival instinct. So they know how to do that, and you just want to teach them how to nurse. They will start doing some rapid eye movements as they're sleeping. Baby's sleep cycle runs about 20 minutes. So if you're having difficulty waking up your baby, maybe they're in a deep sleep, and you can try about half an hour later, and they'll be in a different sleep state. When you see them start stirring around, and if you have them in their bassinet, you see them start stirring around, it's a great time to scoop them up and start trying to wake them and put them to rest. Another great thing is if you just hang out with them, holding them, you'll see them go through those sleep cycles, and that's a great way to drop them down and get them to eat. So how do you know your baby's latched on well? Has anybody heard that you're going to get really sore? You get really sore. So we don't want you to get really sore. So we want the baby to have an effective latch. And we want to help you have a position that's comfortable and more than one position that's comfortable before you go home. And did she show you last week a video of babies latching on in different positions, right, with the football hold and lying down and the cradle and the cross cradle? So mainly when you go to swallow, what do you do when you go to swallow? You throw your head back, right? You throw your head back like that. So we find that if you will nurse your babies with their head thrown back a little bit, then you can drop more breast tissue in their mouth and they can swallow better and drop their jaw better. If you're nursing your baby like this, it's really difficult for them to nurse. And so they tend to do a lot of bobbing at the breast. So think about when you have your baby, not to have their head way over here, and you're sort of taking the breast to them, and they're kind of diving down for it like that. Try to put them right in front of the breast if you're using that hold. Does that make sense without a baby?